So I grew up in a very medical-minded house. Both my parents are physicians and my grandparents and aunts and uncles. So growing up, it was one of those things that was just always there. You know, they always talked about different patients and how they were involved in the care, and it all seemed so exciting and really interesting. You know, they always learned new things and always told us new stuff, and it seemed like a very interesting way to have a job and still feel like you're helping somebody in their life. So I went to college, I was pre-med, and then I found the pre-PA club, and I walked in, and I very vividly remember walking into this group of people and really feeling like these people had all similar interests and they had similar personality styles, and then I fell in love with the idea of becoming a PA. So the journey to get there was pretty straightforward, a little rough getting through school, but I was able to be exposed to a ton of different specialties and really figure out which avenue I wanted to go down. As I started my career in California, I started in primary care and pain management. So it was very medication-based, it was very injection-based, temporary relief for these people that were dealing with chronic pain for years and years. And I realized that I really wanted a heavy hand in how these people were able to live their lives in a happy way, in a pain-free way. And in pain management, I felt that I was a little bit stuck in this kind of limited road. You know, you can't really do much. It's all very temporary. So I started branching out. I ended up finding Dr. Schickman in the Institute for Specialized Medicine and was immediately floored by all the possibilities. You know, there are so many diagnoses, there are so many different syndromes that we just don't realize can cause a lot of these problems that people deal with day to day. So using my knowledge with pain management and my injection skills and all these kinds of things that are very run-of-the-mill, and then introducing this new kind of technique, these new theories and philosophies, was really exciting for me to be able to know that I can help people in a very real way. It was when I started here and meeting a bunch of different parents, and they have children that are dealing with similar things, and then trying to figure out a network of physicians and providers here, we realized that there is just not a lot of people that'll deal with children with similar issues. So I started to learn more about how I can help in the pediatric sector. I went for a little fellowship training with Dr. Charles Ray Jones, who was one of the leading pediatric Lyme doctors in Connecticut, and I ended up being able to open our practice to help a lot of different kids that are really, really struggling and really having trouble finding the appropriate care that they need. And I'm very excited to expand our pediatric practice and already see that we're helping so many children and their parents and their siblings, so it's very exciting. One of the benefits to having an integrative clinic and being involved with a medical doctor and a physician assistant is that we have this base training that's very structured. You know, it's very textbook and it's by the book, but the ability to have a private practice and an integrative clinic to be able to connect these things that have been treated and discovered for so long, but interweave them with some of these diagnoses and symptoms that may not necessarily be directly related in a traditional point of view, but what we found, what Dr. Schickman has found to be very necessary in the terms of treating the whole patient. So the benefit with adults, you know, we see a lot of adults and even kids that come here having seen 8 or 9 specialists and just nothing is adding up. And we're able to look at the whole puzzle, find some of these maybe alternative labs that hospitals and different clinics are not able to do because of their restrictions, and diagnose these people with problems that they might have had for 10 to 20 years or however long they've been dealing with these problems. With children specifically, you know, sometimes primary care doctors or parents may not know that these conditions like Lyme or some of the co-infections can manifest in a rheumatologic way. They can cause some other issues that you need to treat with two arms, I like to say. You have to look at the integrative part of it, figure out what we can do to support the whole body while still understanding that there may be these complications and these consequences for some of these chronic infections. So at this clinic, I feel really lucky to have all of these different resources and treatments and supplements and herbs that really help to connect all the puzzle pieces together and give people the day-to-day relief and ultimately the lifestyle and the health that they're searching for.